Good morning from Brazil. Good morning for Americas. Good afternoon for Africa and Europe. Good evening for the people that are following us from Asia. And welcome to the webinar Managing Continuity and Preparedness of School Feeding Programs under COVID-19 and the South-South Cooperation Role. My name is Daniel Balaban. I am the director of WFP Center of Excellence in Brazil, and I will be your moderator for the session and for the next 90 minutes. Before we delve into our webinar's content, I would like to give you some practical information. Since one of our speakers will be presenting in Spanish, we will have a simultaneous interpretation service available. So if you need interpretation from Spanish to English, all you have to do is follow the instructions you'll see on your screen now. You can either access the interpretation services through your browser or through the app Interprefy. If you are accessing it through your browser, all you have to do is go to interpret.world, insert the token SPORG webinar, and select the option English. If you are accessing interpretation via app, the process is the same. You open the app, use the token SPORG webinar, and select the option English. Today's webinar is part of a very important initiative led by our colleagues at the socialprotection.org platform called Social Protection Responses to COVID-19. This joint effort is inspired by colleagues and organizations working to disseminate and discuss the most recent content on social protection responses to COVID-19. The initiative has three major components. First, a weekly newsletter featuring a compilation of relevant information on social protection initiatives dealing with COVID-19. Second, an online community, and third, weekly webinars such as today's session to foster discussions and exchange. I would like to start by thanking all our speakers and discussants, people who are very busy with their work of maintaining school feeding programs and South-South cooperation during the COVID-19 pandemic, for taking the time to share these important experiences with us. I would also like to thank our participants for your interest in being here with us today. Each of our presentation will last approximately 10 minutes. And at the end of this session, we will have half an hour for question and answers. I will be moderating this question and answer session at the end of the webinar. So if you are listening to us and would like to send a question, just type it into your chat bar on the right side of your screen. I will select a few questions for our speakers. And if you are not able to answer all your questions live, don't worry. Our colleagues from the organization will gather these questions at the end of the webinar and ask the speakers to provide answers to them in writing. Now, let's move to our main topic. Before COVID-19 hit, the world was making positive transitions toward making school feeding an essential social protection and health initiative. WFP has been playing an important role in this context by helping governments to strengthen their capacities to run fully fledged national school feeding programs. South-South cooperation has played a vital role in promoting that transition of programs run by WFP being handed over to national governments. In Africa, for example, 39 countries are already implementing school feeding programs managed and financed by governments. For example, Ghana, Malawi, Kenya, Zimbabwe, all of them, they fed over 1 million children every day. South Africa and Nigeria each feed more than 9 million children every day of the school year. The WFP Center of Excellence, WFP South-South Cooperation Unit, and WFP School-Based Services are working together for this transition to be progressively stronger. However, since March 2020, the COVID-19 pandemic hit the world hard, impairing results and progresses in many areas of development work, including school feeding. The front line into the battle against the pandemic is shifting across the globe, and the crisis is now making vulnerable populations even more vulnerable. COVID-19 is pushing millions out of work and into hunger, disrupting vital supply chains and threatening the very fabric of our society. Children attending schools are among the most affected. In April, almost 1.6 billion children and youth were affected by school closures in 190 countries around the world. This has huge implications for students' learning, health, and nutrition. In countries where schools are closed, WFP is working with governments to put in place alternatives like take-home rations, food delivery at home, providing cash transfers and vouchers. The organization has developed a series of guidance documents and toolkits to support WFP offices and governments to adapt and make programs more responsive to the crisis. My colleague Carmen Burbana, that's here today, she is director of WFP's school-based services in Rome, will talk more about these tools in some minutes. In this scenario we are living in, we must continue at the same time to keep delivering for the most vulnerable and to start thinking about how to continue preparing our programs for the next crisis, be it financial or a second wave of the pandemic. So as a follow-up from our broader insights, we will hear from field-based colleagues, Mr. Pedro Mortara from WFP Mozambique, Mr. Chun Hami from the Ministry of Education, Youth and Sports of Cambodia, and Mr. Juan Carlos Martinez from the Ministry of Education of Colombia. These speakers will bring their concrete perspective and examples from the field on how they have responded to the crisis, how they have worked with WFP and other international organizations, and how they are planning their actions in their short and mid-term for their school feeding programs. To kickstart our session, I would like now to give the floor to an old friend, Mr. Georgi Shediak. Mr. Shediak is the director of the United Nations Office for South-South Cooperation and the United Nations Secretary General's Envoy on South-South Cooperation. Mr. Shediak also served as UN Resident Coordination in Brazil from 2010 to 2015, and he was the director of UNDP's International Policy Center for Inclusive Growth. He helped to create the IPCIG. Mr. Shediak holds a Master in Science of Foreign Service from Georgetown University and a Bachelor in Science in Political Science from the Catholic University of Buenos Aires. After the Pope, Mr. Shediak is the most important Argentinian that I know. Mr. Shediak, the floor is yours, my friend.
Thank you very much, Daniel. I think Messi will be probably offended with your characterization, but let's leave it there. Dear friends, as Daniel says, I'm very proud to be with many good and old friends. While I was a resident coordinator in Brazil, as Daniel mentioned, I was a director of IPC. We turned it around, we created a new business and academic model, and it was one of the highlights of my 30-year career with the United Nations, being able to work with such a dedicated team and being able to establish a very strong institutional framework that continues today. So I'm very proud to be in an event organized by them. Also, Daniel, I was present in Brazil when the WFP Center was established, and it has become a remarkable center of reference worldwide on school feeding, thanks to your extraordinary leadership and the very strong commitment of WFP to South-South cooperation and to sharing experiences with other countries. So it's a great pleasure for me to be here to participate in this event. And from our perspective, this is part of a series of webinars we have put together. So far, about 23 of them, in which we try to analyze how COVID is affecting the global south, how countries are responding to the challenges that the pandemic is generating to their own development, and how we can promote exchanges of those experiences for addressing these challenges. And the one we are discussing today is extremely relevant. Food, feeding, is one of the basic elements of human life. Without food, we don't survive. And without adequate food, appropriate food, proper development of our children is not possible, and proper integration of the people and living normal lives is also not possible. So having or exploring how countries have addressed the issues of how to resolve the problem of food security during the pandemic is absolutely critical. So we're very proud of being working on this event. The World Food Programme has estimated that 265 million people could face acute food insecurity by the end of this year, up to 135 million people before the crisis, because of the loss of income and also the loss of remittances that is a result of the deglobalization that we are experiencing. Also, many food producers are facing large losses on perishable and nutritious foods as the supply chains are disrupted and also the consumption patterns shift. So food insecurity, as we know, is no longer led for or the result of global food shortages, but at the same time, the disruption of the supply chain, both at the productive level and the distribution of the product levels, really have a very negative effect and can also create the basis of future problems by limiting the capacity of generating new crops in future years. According to the World Bank, food security will mostly impact the countries that are considered by them the hotspots. Those include the fragile or conflict-affected states, where logistics and distributions are difficult, even without morbidity and social distancing. Countries affected by multiple crises resulting from extreme weather events like floods, droughts, and pests, like the current locust plague, that is the worst in decades, that is impacting food production in at least 23 countries. The poor and vulnerable, including the more than 820 million people that are already chronically food insecure before COVID, and the countries that will suffer significant economic problems, particularly on the external balance, either because they will not have the resources to purchase food, or maybe the commodities they produce will not regenerate the same pricing that they had before the crisis. This is one example on the COVID, how the COVID crisis is affecting the world, to the point that according to a UNDP estimate recently published, this will be the first year since the Human Development Index was created in 1990 that at the global level, humanity will experience a decline, will be worse off globally in terms of human development, in terms of our road to achieving the Sustainable Development Goals than we were 1 year before. So this is critical. And the idea of having these events is to share experiences, as I mentioned, and see how we can mitigate the challenge, and also, excuse me, and also how we can build back better, as our Secretary General calls for. In the area of school feeding, as April of 2020, schools closed in more than 190 countries, affecting 1.57 billion young people, 90% of the world's student population. According to WFP, an estimated 370 million school children, missed out on school meals and other essential services such as water, sanitation, and hygiene. For these children, the food they receive at school is often their only meaningful meal of the day. As we said, lack of school food weakens children's immune system, making them paradoxically and negatively more vulnerable to infections, including COVID. In general terms, it deprives them of a lifeline to health and nutrition. So we really have to find a solution or solutions, because there will be no single answer, as there are no single systems, to how to replace or incorporate alternative mechanisms to supplant the problems that the closure of schools generated in the feeding of young children. And we have some good experiences. In Nigeria, the Ministry of Humanitarian Affairs committed to develop a strategy on how to sustain their school feeding programs during school closures. And they are already succeeding, and they're employing over 100,000 cooks doing the cooking and ensuring that the food reaches the children, although they do not go or they do not attend school. In South Africa, more than 11 million children are out of school. And the Tigers Brand Foundation is currently working with the Department of Basic Education to identify the food insecure families and provide food support to those schools that they are sponsoring. In Colombia, the Ministry of Education announced that children benefiting from the school feeding program will continue to receive food supplies at home as long as the schools are closed. So basically, we see there are many answers being provided. And that is why we from Promoting South-South Cooperation are so interested in working with these initiatives. As you're probably aware, last year we had a large global conference on South-South Cooperation that took place in Buenos Aires in Argentina, and it generated a seminal document in which it calls on South-South and triangular cooperation to be intensified, to work more broadly in all the areas of human development. It mentions specifically food security, it mentions specifically agricultural production, and it calls on the whole world, the developing world, to engage in South-South cooperation and other partners, including the developed partners, to support it through triangular cooperation. And we know it works because our office has been documenting many successful experiences from the Global South and has also been documenting concrete exchanges that generated changes in policy. And you, Daniel, with the work you do in the center and the ones that have also been created in Ivory Coast and China and India, are putting WFP as a vehicle for this type of knowledge sharing and policy innovation. And you are doing a fantastic job, for which I'm very proud, and I really want to thank you especially again. Our office is committed to continue doing the work. We are working with many countries of the Global South, finding from them the interests of policy areas that they want to articulate to respond to COVID. And we're utilizing our platform called South-South Galaxy, which I really invite all of you to utilize and join, that already have more than 200 institutions sharing their experiences. And it has the added value that in addition to sharing, being a depository of experiences, it also establishes mechanisms to broker partnerships. Also, we are mobilizing thinkers from the Global South through our Global Thinkers Initiative to provide new ideas, new analysis on how we can confront the pandemic, and as I said, and the Secretary General says, to build back better. Also, in the next few days, we're launching a digital innovation challenge, which is how to utilize the fourth generation technologies to respond to COVID and also to generate ideas for the post-COVID. Actually, before this event, I was in a seminar on the use of digital technology for tourism, which, as you know, was the economic activity most affected by the restrictions imposed by COVID. So we really will continue committed to knowledge sharing. And finally, as part of our mandate, we have been trying to mobilize some resources for South-South cooperation in the area of the response to COVID. And we have succeeded. We have mobilized about $20 million, which we are providing to different countries and to support different initiatives in the context of our India UN Development Fund, the India, Brazil, South Africa Fund, the Trust Fund that our office manages, the South-South Trust Fund, and also through the Pérez Guerrero Trust Fund. So we're mobilizing these resources to promote South-South cooperation in the context of COVID. We remain fully committed to these great partners. IPCIG has become a global reference center on social policies and social protection. WFP is leading the world in exchanges on how to achieve food security in complex situations. And we're really committed to building on these partnerships. Look forward to the continuity of this event, to listening more experiences, and for all of you, the more than 266 people who are out there, to join in the fight to build more South-South cooperation, more triangular cooperation, to build a better world and to overcome the challenges from COVID and post-COVID. Thank you very much.
Thank you very much, Jorge. I would like to remember that when the center was created in Brazil, Mr. Shediac was the resident coordinator. And in our first meeting, when we started to explain the idea of the Center of Excellence, he was the first one that said, wonderful idea. You have all my support to establish the center here in Brazil. And since of that day, he gave all his support to the success of the Center of Excellence in Brazil, and I'm very grateful for that. And as Mr. Shediac said, we are living in a different times and we need different solutions. We strongly believe that South-South cooperation is one of the solutions to support the countries in this moment. Not when we are suffering from the COVID, but even after the vaccine, after the COVID, we need to strengthen our South-South cooperation activities. About the Galaxy platform of South-South cooperation is wonderful. I use it, and please, who is listening and didn't use yet, please try the platform. It's fantastic to know more about South-South cooperation. Thank you, Jorge. Thank you for being with us today. Now we will hear from my friend, my colleague, Mrs. Carmen Burbano. She is currently director of WFP School-Based Services. Changed the name. It was just for school feeding. Now it's more school-based services in our headquarters in Rome. Mrs. Burbano is WFP's world expert in school feeding and a member of the technical committee for school feeding of the Partnership for Child Development at the Imperial College in London. She is the co-author of the most influential publications on school feeding over the last 10 years. Carmen is Ecuadorian. She is also from South America, holds a master's degree in public administration from Harvard University, and a bachelor in Latin American studies and comparative literature from New York University. Carmen, we're thrilled to have you here. Please go on.
Thank you so much, Daniel, for the invitation, and nice to see you, Jorge, as well. It's a pleasure to be speaking to all of you today. My intention with my remarks is really to give us a little bit of a framework of what we're talking about here today. The title of this whole conference is managing the continuity of school feeding operations during COVID, and how can we leverage South-South cooperation and opportunities. So kicking off this chat, this webinar, I want to give you a sense of why this topic is so important. Jorge, in his introductory remarks, mentioned that through school feeding programs, which means basically either breakfast or lunch or snacks in school or a combination of those, children all over the world receive, and in many cases, they receive the only meal that they get every day. This is true especially for the most vulnerable children. So these are crucial safety nets that were present before the COVID crisis in almost every country in the world. But this is not the only reason why these are important programs. So let me go to the first slide, just to remind ourselves why these programs are so important. First, they allow children to get an education. They are really important incentives for parents to send children to school. We have evidence and documentation that these programs increase enrollment, they increase attendance, and they have a disproportionate effect on girls. Whenever there's a school feeding program, we know that girls are going to come back to school at a higher rate than if there was no program in that school. So this is a really important draw for parents to send their children to school. Obviously, the second reason is it supports children's health and education. In many schools around the world, we see vulnerable children that are anemic, that are coming to school without having any breakfast, so they come to school with an empty stomach. And these programs help to address issues related to their health, to their nutrition, and also educate them on eating better. The third thing that we need to remember is that these programs are also really important investments in local agriculture. And when they are combined with local purchase of food, they can benefit smallholder farmers all over the country. They can benefit also catering companies that are locally run. They can provide employment opportunities across the supply chain. So these are community platforms that not only support the children, but also support the entire community around the school. And finally, a really important element that we've seen now in the COVID crisis, the importance of these programs as social protection measures, as crucial safety nets that families really count on so that their children can get a hot meal, a nutritious meal. This also represents an income to the family, an indirect income transfer. So if we imagine a family of a vulnerable family, a poor family, and they count on that meal that their child receives every day at school, this replaces about 10% of their income. They can use that money every month to spend it on other things, or perhaps to spend it on the food in the evenings, or to cover for other needs of the household. So these are very important programs that families all across the world count on. When the COVID crisis hit, as Jorge was saying, about 90% of the world's school children were sent home. One of the initial very important discussions all around the world, and these were discussions in the US, in European countries, and also in developing countries, was what to do with all those meals that children will not have access to right now. This became a really important emergency, and the next slide will give you a sense, according to WFP monitoring, of the impact that these programs have had on the number of children that are missing out on school meals. So can we show the next slide, please? This map shows you WFP's monitoring of the number of children missing out on meals. It's around 370 million children that are affected across the world. And as countries have started to look at reopening their programs, of course, this number is changing, and it's changing almost every day. So it's difficult to keep these numbers updated, but you can go to WFP's website where this map is live, and we are constantly updating these numbers. We are particularly preoccupied or worried about children in developing countries, in the most fragile countries. And in this map, you can see the blue dots there. These are where the World Food Program has operations and where we are monitoring and working with governments to find solutions to these meals, to these children that no longer have access to the meals. Let me tell you a little bit about what we saw in terms of government responses to this massive emergency. Next slide, please. We saw governments all across the world. The latest tally that we have is that around 71 countries across the world found alternatives to ensure that children continue to be supported. In high-income countries and upper middle-income countries, the ones you have at the top, countries have put in place alternatives like food stamps assistance, vouchers, parcels delivered to houses, etc. This is the case of the US, it's the case of the UK, many countries in Europe. But we also have very strong responses from middle income and low income countries that have predominantly focused on take-home rations. What this means is basically the food that the child should have consumed at the school is now being provided to their families through various mechanisms. We also see countries working on vouchers and cash assistance to families to compensate for the loss of that meal. We also saw an enormous mobilization of UN agencies under a UNESCO-led coalition to support countries affected through their education sector responses by COVID. And as I was mentioning, a huge preoccupation starting from the Secretary General himself into different agencies mobilizing to support and provide guidance to governments on how to do this. So next slide, please. As the slide goes up, I'll start to explain. Next slide, please. The UN system mobilized to produce a number of guidance pieces to support governments in making this decision and finding better ways of assisting countries. You have here some pictures on the available guidance that you can find, both a framework for reopening schools that was issued by the World Bank, UNESCO, UNICEF, UNHCR, and the World Food Program, and also different kinds of analyses led by, for example, the World Bank, this one that says the COVID-19 pandemic, and two policy briefs led by the Secretary General, one on the impact of COVID on food and security nutrition, and another one on the impact of COVID on children more generally. All of them have this big preoccupation in detail, a call to action to ensure that children, especially school children, are supported during the COVID crisis because they have been so disproportionately affected. We are perhaps very concerned about marginalized children, vulnerable children, because we know from past experiences, from past pandemics like the Ebola crisis, that the longer children stay out of school, the less likely they are to return. This is particularly important for girls. We are concerned as UN agencies that girls are at risk of getting married very early, getting pregnant very early, being put to work, and other kinds of protection concerns that children are now exposed to because they no longer have access to the education system. It is really important that when governments start to reopen their school systems, they put in place incentives such as school feeding and other kinds of incentives around school health and nutrition that really serve as a draw or as an incentive for parents to send their children to school. Let me go to the next slide, and I will be very quick about this because I know that we have a lot of panelists here to share with us some of the country experiences. Just to give you here an example of some of the resources that are available for countries. And here you have WFP's tally of the global map of how many children are affected. We have the framework for reopening schools that I was mentioning, and the World Food Program, FAO, and UNICEF issued guidance for nutrition in schools and how to continue these programs in the context of the COVID crisis. So you have here some of the resources that are available. This presentation also includes country examples. So if we can move to the next slide. And I will be very brief because I know we're all looking forward to listening from my colleagues in the field and country leaders that are really struggling with this and have found solutions. But here you see a number of countries that have been very creatively working to reach 125,000 children in Chad through take-home rations. In Niger, around 150,000 children are being reached also through take-home rations, and especially girls through cash transfers are supported. The similar analysis we've seen in South Sudan. We've seen mobilization from agencies in Nicaragua to support the government ramp up its support. If we can move over to the next slide. Here you have more examples of what's happening in Madagascar, in Laos, in Yemen, and Syria. And as I was saying, these are not the only countries. We have information of about 71 countries that are finding very creative ways to support children throughout the crisis. To finish, can we move on to the next slide and the next one after that? Okay, just to finalize, let me just say that WFP, the World Food Programme, and UNICEF have joined forces to support specifically the fragile countries that need external international humanitarian assistance. We are particularly concerned about the status of about 10 million children living in these countries that really need urgent support for an integrated school health and nutrition package. We will be working with a coalition of partners, as I said, led by WFP and UNICEF, to ensure that the most vulnerable children are not lost in this COVID pandemic. I would just like to finish by saying we really all need to work together, both government leaders, national decision makers, UN agencies, donors, the private sector, to ensure that we are not losing an entire generation of children that are vulnerable right now and that might never return to school if we don't do something about it now. Thank you so much, Daniel, and for the organizers for inviting me to speak today.
Thank you, Carmen. Fantastic presentation. I love it. I remember that I met Carmen for the first time. It was in the year 2005, 15 years ago. I was in the Brazilian government and she was presenting in an event. I don't remember the event, but it was in Cape Town in South Africa. And she was presenting about WFP's working on school feeding since of then. Of course, we became friends and we started working together. I came to WFP and we are trying to move the road and work to support the countries to create sustainable school feeding policies all around the world. And as Carmen said, girls, we need to take care of the girls because they are the most, in some countries, girls just go to the schools because of school feeding. It's sad, but it's true. And we need to, but then now that the kids, they are out of school, it's a problem because a lot of kids, they need to return. And when we have so many kids are out of school for so much time, it's something that we need to be care because it's very difficult to take them back to the schools. So what Carmen said, it's fantastic. Thank you, Carmen. Let's move on now. We will have our next speaker. We will initiate our presentation in school on country experiences. Mr. Pedro Mortara is a program officer, policy officer at WFP Mozambique, where he leads WFP school feeding implementation and capacity strengthening activities. Before this, he managed an urban social protection program in Zimbabwe and served as field response coordination for the Cyclone Idai response. Pedro has worked with WFP also in South Sudan, Ethiopia, and in headquarters in Rome. holding various program positions. Pedro has a master's degree in international political economy from the University of Warwick in the UK. Pedro, we look forward to hearing about Mozambique's experience. Thank you.
Thank you very much, Daniel. Good morning, good afternoon, and good evening. First of all, thank you for the invitation. It's a pleasure to be here with you today and share a bit about what we've been doing here in Mozambique to maintain the ongoing programs on school feeding. So, first of all, I'd like to give a bit of a context in terms of what is happening here in Mozambique and especially what was happening when COVID arrived. Mozambique last year faced two deadly cyclones, Cyclone Idai and Cyclone Kenneth, that affected the center and the north of the country. And apart from the many deaths, it also led to a large number of people displaced and a high impact on the education sector, with many schools damaged and children never being able to attend school again. On top of that, we have had recurring droughts in the south and floods in the center and north of the country that are mainly due to climate change and have been increasingly stronger every year. And on top of that, we have a conflict in the north, in the Cabo Delgado province, that not only left many districts inaccessible to humanitarian aid, but also led to a high number of people being displaced to different parts of the country. So this is what especially Jorge mentioned in terms of being a crisis within crisis. And Mozambique is considered now a hotspot for food security issues in the near future. And in March this year, when COVID arrived, the Mozambican government, like many other governments, closed all schools. And the issue is that with the poor infrastructure in many of those schools, it has been very difficult to put together a plan to reopen those schools. So you have a very small number of primary schools that have access to clean water and to toilet facilities. So this makes it very difficult for you to ensure that there is proper hygiene for the children to return to schools. And as a result of that, all the school feeding interventions were stopped. And of course, this creates the many problems that Carmen was just mentioning, not only the school closure, but also the lack of school feeding for those children that were used to receive that kind of food, of support. And we as WFP, in partnership with the government, had to adapt. So we made use of a very well-known modality of take-home rations, which we had tried before and very successfully supported over 90,000 children after Cyclone Idai. And as Carmen also mentioned, we saw the real impact of that program with a 25% increase in enrollment, given that this was a 2-trimester program between the last trimester of last year and the first trimester of this year. And we could really feel the impact and see the numbers of that impact in those communities. So after the closure of schools this year, in partnership with local authorities in the central province of Tet, we started a take-home rations to support the families of 41,000 children that in that area were now cut off from their school feeding support. And this support was very well taken, and it's important that we explain a bit about how this was done. So more specifically, what were the measures that were done to adapt to the social distancing regulations for COVID. And I must say that a lot of the frameworks that Carmen mentioned were were used not only for these adaptations, but also in a lot of the work that we do with the government in advising them and working with UNICEF and UNESCO and supporting to put together their plans for the reopening of schools, the safe reopening of schools, of course. So in terms of our school feeding programs, in advance of distributions, we ensured that both school staff and the local retailers that had been contracted to deliver that food were repackaging and ensuring that the individual packages for each family were already assembled. So this would reduce the burden on the distribution day, and of course reduce the waiting time for each family, and of course reduce the crowding on the food distribution point. On top of that, in advance, we also ensured revised lists. We have to make sure that all the children are in or the families of every children enrolled in each single school is part of that list, but also that there's no one else on top of those children. And also reinforcing baskets. So baskets that would not only reflect the amount of food that each child received through a normal school feeding program, but a reinforced basket to support their families. Normal school feeding programs in regular on-site school meals modality would give a percentage of kilocalorie intake for 20 days, 20 school days of a month for each child. And now we want to support those children for 30 days, and assuming that each basket will be shared within the household, we needed to reinforce those baskets. So adding a bit more food and maintaining a good nutritional intake for the child and their family members. So also we ensured that only caregivers were there to collect the baskets to reduce the risks and exposure of our children. On the very distribution day, we created hygiene and social distancing measures with buckets, soap, all the distancing that you can see in the picture of the slide. And we distributed paper vouchers to each single family that arrived at a different time to give them a time slot so that there's no crowding and everyone feels comfortable that their time will come and they will be able to redeem their entitlement. So they received the time slot to come to the distribution point. And during the distributions, we sensitized communities on COVID-19, mainly prevention, but also how to behave when there are symptoms in different channels. So we used communication channels at the food distribution point, mainly printed banners and information on flyers. We've also did trainings to community leaders and community members and caregivers together with the school staff. And third, we also had community radios to include slots for pre-recorded messages that were approved by the Ministry of Health. And finally, we started raising awareness on the protection risk for children. This is something that also Carmen and Daniel mentioned several times. It's been highly proven that the most affected children in this kind of situations are girls, not only but mainly because of early pregnancy and child marriage. So we've done a lot of work on awareness raisings for these kind of protection risks for girls. So now this is an overall summary of our operations, but it's also very important that we talk a bit about the policy level discussions that we have had. And in Mozambique, we have PRONAE, the National School Feeding Program, Programa Nacional de Alimentação Escolar. PRONAE was created as one of the most important landmarks in terms of South-South triangular cooperation for school feeding, and definitely a landmark for the school feeding landscape here in Mozambique. It was trilateral cooperation between Brazil, WFP, mainly through the Center of Excellence Against Hunger in Brasilia, led by Daniel, and Mozambican government to establish a school feeding program that would in time be nationalized and be fully managed by the Mozambican government. And PRONAE, we see some short-term measures or ideas that we need to advance in the national school feeding program. So first of them is the understanding that take-home rations can potentially be a benefit in specific contexts, such as the crisis that we're living now, but also other crises, such as Idai, for example. The program PRONAI was designed as an on-site school feeding program, and it's sometimes very difficult to adapt if a framework is very well designed and very focused on one type of modality only. And we need to work with the government to ensure that there is this kind of understanding so that we can move PRONAI into also a take-home rations modality and work with the government, showing all the other examples from other countries to reach that level. And in a more medium long term, we also need to work to improve the government capacity for preparedness and response. So ensuring that all the documents that reflect that, the policies for crisis context in the education sector reflect very precisely how school feeding should be changed to adapt and be able to continue supporting the communities that it's meant to support. Increase the funding base, as many countries funding is a big restriction here, and we need to ensure that we have better funding for a longer term perspective and increased support to children. We should also advance in the legislation, so ensuring that there is a legal framework for school feeding that also takes into account the emergencies and how to be prepared and respond. Improving intersectoral coordination with especially ministries of health and agriculture should also be a very important point to be better prepared to respond to emergencies. And of course, increasing coverage, reaching more children would be a key aspect to be a more important tool to respond to emergencies. Now, this type of policy engagement as a very important tool to address it. And for us, South-South triangular cooperation is this tool that should take us to this strengthening process. And there's a number of aspects that we think that should be advanced for us to get there. And as I mentioned, South-South triangular cooperation could help bring what was done in other countries to Mozambique in terms of emergency response plans and how school feeding is included there, ensuring that these alternative modalities are part of the policies. One of the most difficult parts for you, for any school feeding program to be managed during an emergency is how to make sure that the local procurement systems are maintained during emergencies. So PRONAI has a very strong homegrown component. So buying from smallholder farmers, as Carmen mentioned, and bringing to the schools of those very same communities. And how do we ensure that when we change modalities, we maintain this local procurement? Because remember that smallholder farmers were also expecting to sell their produce to schools that are now closed. So they are also heavily affected by these closures. And strengthening their supply so that these farmers are also ready to respond to an emergency, adapting themselves, changing the way they sell their produce, changing what is their produce. These are also important measures to take place. And finally, the continued engagement on this sort of strengthening of PRONAI systems should be focused on adaptability. So right now, I think there has been in the last few years a very important and probably the biggest step of pushing towards having structured and strengthened school feeding systems in several of these countries. But it's also important that we ensure that these systems are also adaptable to the different crises that might come. So I think this is what I wanted to show you today, and it's not an easy situation overall, that's for sure. But I think if we work together, we can definitely help ourselves to improve and serve these most needed communities. Thank you.
Thank you very much, Pedro. I would say that Pedro is the right guy in the right place. Mozambique needs someone with your skills. I know the work, the brilliant work that you are doing there. It's a challenge because it's a wonderful country with so many possibilities. They want to strengthen their national school feeding program, but they face a lot of problems there. They had the cyclone last year, now with COVID-19, but I'm sure that they will achieve their goals, and with your support, with WFP support in Mozambique. Thank you, Pedro. Now let's move on and continue with our voices from the field. I have the pleasure to present Mr. Juan Carlos Martinez from the Ministry of Education of Colombia. Mr. Juan Carlos is an engineer graduated at Universidad Pedagógica y Tecnológica de Colombia, UPTC, with a specialization in development projects from the Escuela Superior de Administración Pública, ESAP. He has extensive work experience in the areas of planning and territorial development, and more than 20 years contributing to the education sector. In the Ministry of Education, he has led the areas of courage, planning, and rural education. Mr. Martinez has also acted as Secretary of Education and Planning in Bocaya and Tunia, and as an advisor and professor in a series of research and education institutions. I would like to remind that at this time, Mr. Martinez will be speaking in Spanish. So if anyone needs to use our interpretation services, you can follow the instructions we gave at the beginning of the session for the next presentation. Mr. Martinez tiene la palabra. Gracias. Estás con el mic desligado. Tiene que ligar el micrófono.
Gracias, Daniel. Muchas gracias. Y un saludo para ti y para todos los miembros del Programa Mundial de Alimentos. Un saludo para todos los asistentes a este importante webinario. Espero poderles aportar algo de nuestra experiencia en Colombia. Es importante mencionar que para el señor presidente, para el país, fue claro que era imposible hablar de un aislamiento social que nos permitiera atender la crisis de la pandemia sin garantía alimentaria en los hogares. Y eso implicó la decisión de que todos los programas sociales involucrados en procesos alimentarios siguieran operando, así se estuviera en proceso de aislamiento. No solo este programa de alimentación escolar, que era un enorme reto, ver cómo llegábamos a seguir suministrando el alimento a los estudiantes en este país tan disperso, un país con más de 1.100 municipios, con un porcentaje de 40% que vive en zonas rurales dispersas, con más de 40.000 sedes donde normalmente se presenta alimentación, era un reto enorme, pero también había que seguir en los programas alimentarios que maneja Bienestar Familiar para la primera infancia, para los adultos, en los otros programas de apoyo social. Sigue, por favor. En ese sentido, el primer reto era lograr tener unas reglas que nos permitieran que todo siguiera funcionando. No solo garantizar que no se nos perdieran los estudiantes en esta época y seguir garantizando el bienestar de los estudiantes en sus casas, porque hay la decisión de seguir en el proceso de aprendizaje en casa, con muchas estrategias que definió el Ministerio de Educación, sino garantizar que además todo el esquema operativo que implica toda una gran desarrollo laboral desde la producción de alimentos, la distribución, el servirlos, el hacerlos llegar a los estudiantes, pudiera seguir garantizando su funcionamiento y por tanto las economías locales también continuaran. Sigue, por favor. Lo primero que teníamos que resolver era el tema normativo. Y en ese sentido fue muy rápido. Estamos hablando de que en Colombia el primer caso identificado, probado, fue el 7 de marzo, y el 15 de marzo ya el señor presidente tomó la decisión por decreto del aislamiento social por emergencia sanitaria, y en consecuencia todos los establecimientos escolares cerraron a partir del día siguiente, el 16 de marzo. Y ya en ese momento teníamos incluso alimentos en todos los establecimientos educativos. Por tanto, en un solo día fue necesario sacar lineamientos para que ese alimento no se perdiera, para que ese alimento fuera distribuido a las familias de los estudiantes de manera sencilla, fácil y con la mayor posibilidad de diferenciar esquemas de solución a nivel territorial. El 17 de marzo, 2 días después, ya salió un decreto nacional que autorizaba a cambiar todas las normas del programa de alimentación escolar para permitir que funcionara en la casa, porque la norma hablaba solo de alimentación en los colegios, para que funcionara, así se estuviera en etapa de receso académico, porque se quería que se cubriera todo el tiempo de la crisis que genera, la crisis social que genera esta pandemia, esta crisis sanitaria. Y se hizo las resoluciones correspondientes, luego se hizo una que lo prolongaba, porque desde el comienzo uno de los, creo, importantes factores de éxito del país fue no pensar en corto plazo, fue pensar que el cambio normativo debía cubrir todo el tiempo que fuera necesario hasta que saliéramos de esta enorme crisis generada por la pandemia. Sigue, por favor. Y así fue como se cambiaron los lineamientos, no solo en los procesos contractuales. En Colombia es descentralizada la operación y son 96 entidades territoriales certificadas las que administran los municipios mayores de 100.000 y los departamentos, que son los que aglutinan los municipios, los estados en otras partes, que manejan en los pequeños municipios la educación y consecuentemente la alimentación. Y era necesario también establecer alternativas diferentes, porque en Colombia esto lo administran estas entidades con sistema contractual, con sector privado, pero esos contratos están para unas raciones servidas, procesadas en el establecimiento educativo y con unos costos que consideran esa realidad. Y el recurso ya estaba en buena parte comprometido ahí. Se podía sumar algo, pero lo más importante era pensar en el largo plazo y en consecuencia pensar que todo ese recurso tendría que salvarse. Por tanto, se habló de cambiar los contratos, de generar normatividad especial que permitiera de forma sencilla o ágil modificar los contratos y además, por un lado, sí, nos servía el complemento alimentario que llegaba como ración industrializada, pero eso la minoría. ¿Cómo reemplazar la comida en caliente en el colegio? Pues la única alternativa es con una canasta de alimentos que llegue a la casa para poder ejercer el mismo efecto en la casa, y la alternativa más urbana de poder recurrir no a una distribución, sino a un bono o tarjeta para reclamar los alimentos en una gran superficie. Se trabajó para que al máximo fueran entregas mensuales, si no fuera posible quincenales, por poco semanales, pero ojalá, y casi todos hoy lo están logrando, que la entrega sea una única al mes, para justamente apoyar al distanciamiento social, para disminuir los tiempos de interacción, sumando, como muy bien lo mencionaba ahorita desde Mozambique, Pedro, todas esas estrategias de aislamiento, de separación, estableciendo llamadas por listas, por cursos, a horas diferentes, en momentos diferentes, para evitar aglomeraciones, y haciéndolo con lista estricta de los estudiantes. Colombia tiene un sistema en ese sentido fuerte, con identificación 1 a 1 con sus familias, y en consecuencia puede hacerse la verificación de la entrega específica, con además guías para el manejo en la casa también de los alimentos, e incluso ideas de posibles minutas, pero además tuvimos que cambiar todo el esquema de supervisión e interventoría, porque no podía operar el que existía en el pasado en la condición presente, que estaba más soportada en los docentes y directivos docentes. Esto es un esfuerzo muy grande. Sigue, por favor. Y como efectivamente entraba a asumirse unas semanas que antes eran de vacaciones, el programa de alimentación solo funciona en tiempo regular, la nación puso recursos adicionales para garantizar que también se cubrieran esas semanas sin desfinanciar el programa en el resto del año. Nos muestra cómo el 88% de esas 96 entidades territoriales certificadas prefirieron esa canasta alimentaria para llevar a la casa, solo un 21% optó por el refrigerio industrializado y un 5% utilizó la estrategia de los bonos. Y vemos cómo en el mismo marzo, en los primeros 15 días, ya 35 de las 96 entidades territoriales lograron modificar sus contratos, sus esquemas de suministros, su organización institucional y de supervisión, y desde esa primera quincena empezar a hacer la entrega. 79 ya estaban activos en el mes de abril, y en mayo y en junio 95. Solo hay uno que ha tenido problemas serios de arranque. Eso significa que más de 5.100.000 niños de los 5.600.000 que venían recibiendo la alimentación que corresponde a las familias que están en establecimientos donde hay el mayor porcentaje de vulnerabilidad, están recibiendo esta alimentación. 2 millones de niños ya han recibido 4 paquetes mensuales, 1.403.000, eso dependiendo de en qué mes o en qué semana logró empezar cada una de las entidades territoriales. Y 38 que tienen población indígena están siendo atendidas con sus programas específicos, con su diferenciación en las minutas y en las formas de administración, respetando su autonomía. Sigue, por favor. Bien, en el caso colombiano, como les decía, fue necesario hablar de la necesidad de reajustar todos los recursos que existían disponibles para que no se perdieran, para poder garantizar la sostenibilidad, para no hacer algo muy bueno que sirviera solo un mes, pero que no fuera sostenible por varios meses, porque desde el principio era claro que esto iba a ser de más largo aliento, y en consecuencia toda decisión que tomáramos debiera ser prolongable en el tiempo hasta que sea necesario y pueda volverse a la normalidad académica. La autonomía territorial para poder adecuar las minutas a esa realidad, porque por supuesto empezaron a existir problemas de desabastecimiento, algunos productos con enorme dificultad de conseguirlos, y por otro lado cosechas que por el cambio que generó en el mercado se perdían. La posibilidad territorial de ajustar sus minutas manteniendo la calidad del paquete alimentario fue fundamental también para este proceso. Y eso fue un factor importante de coordinación interinstitucional con el Ministerio de Agricultura y con las entidades territoriales. Sigue, por favor. ¿Qué quiero resaltar aquí de las lecciones aprendidas? Uno, definitivamente, siempre que hay un cambio, es fundamental intensificar la capacidad de atender de manera inmediata a toda la diversidad de inquietudes y preguntas que se dan en la diversidad de condiciones de los territorios. Y por eso ese fortalecimiento del acompañamiento territorial. Pero lo que no hay duda es que tenemos que fortalecer más los sistemas de información. Esto yo creo que fue una lección mundial. Todos tenemos que aumentar la capacidad de tener sistemas de información en vivo, mucho más ágiles, para poder hacer frente a estas situaciones. Y por supuesto el aprovechamiento de la experiencia territorial e internacional, como lo estamos haciendo ahorita, el apoyo que también nos viene prestando en la Nación, el Programa Mundial de Alimentos, nos ayudó a conocer posibilidades que nos sirvieron para verlas, pero también las experiencias territoriales. Muchas entidades territoriales en el pasado tuvieron problemas de inundaciones, tuvieron problemas de derrumbes, tuvieron problemas de terremotos que implicaron también acciones y que generaban alguna experiencia de asistencia social que ayudaron a aportar ideas de cómo trabajar en esta situación. Algo que es claro es que la normatividad tiene que permitir, o sea, no puede ser que cada vez que hay una situación atípica se tenga que esperar a cambiar la normatividad. La normatividad tiene que tener la flexibilidad de atender en los casos críticos cuando se determine que es necesario mantener ese apoyo a la población más vulnerable en este aspecto tan fundamental como es su alimentación. La coordinación intersectores creo que fue importante y creo que hay que encontrarle mecanismos más permanentes de aprovechamiento. La autonomía territorial es indispensable porque la diversidad y condiciones de formas en que se presentan los problemas y las atenciones y las condiciones hacen que las camisas de una talla sean inaplicables y lo que hay que tener es una mayor capacidad de apoyar esa diversidad con unas reglas, lógicamente, que permitan controlar que no se salga del objetivo fundamental. El ajustar todos los mecanismos y protocolos a esta emergencia sanitaria nos hace ver que en muchos casos también hay otras formas de mejorar las condiciones de inocuidad y nos pueden aportar para ellas. Y por último, como vimos, digamos, esos 500.000 niños entre los 5.600.000 y 5.100.000, en algunos casos son dificultades de lograr llegar. Pero en otros casos corresponde a que los pequeños municipios donde hay un solo establecimiento, no todos son vulnerables, pero está focalizado en el establecimiento completo y no a todos les interesó luego ir por el paquete alimentario y prefieren el aislamiento o algunos por sus distancias les saldría excesivamente costoso. Sigue, por favor. Bien, para rematar, quiero resaltar que ha habido un esfuerzo enorme de todas las entidades territoriales en este país, entendiendo que no pueden las formas burocráticas, los temas burocráticos estar por encima de la necesidad social. Y es el Estado, son los actores públicos los que tienen que ser capaces de adaptar todas las condiciones para garantizar estos derechos. Es imposible pedirle a la población vulnerable que está aislada, que esté guardada en sus casas sin garantía alimentaria. Sería un despropósito absoluto quedarse guardados sin prestar este tipo de atenciones. Espero haberles sido útiles. Muchas gracias.
Muchas gracias, Juan Carlos. Estamos muy contentos de tener aquí la experiencia de Colombia. Muchas gracias. Now move on to our last but not least speaker. We have Mr. Chun Ha-my, the Deputy Director of Cambodia's Primary Education Department within the Ministry of Education, Youth and Sports. Mr. Chun has worked in the Ministry of Education since 2003, where he is responsible for planning, monitoring, and reporting on the primary education subsector. He obtained his bachelor's degree in accounting in 2002 at Cambodia's National University of Management and got his master's degree in finance in 2005 from the same university. His main goal in the Ministry of Education is to work with the school support committees of all primary schools in the country to improve community involvement at school level. Mr. Chun Ha-my is currently working on the programs primary school feeding and early grade learning. Mr. Chun, the floor is yours. Thank you very much.
Thank you for giving floor for me tonight. In Cambodia, it's nearly midnight. Good evening, all. I have 4 main points today for show. First, about some background of Cambodia for school feeding. Second, the urgent response Cambodia for COVID and the third about the challenges during the responding for COVID, and the final is what is the move forward in the future. And about the background of Cambodia for school feeding, we implement we cooperate with World Food Program, implement the school feeding program since 1999. And until now, we have 3 programs: school meal, scholarship. We have food take-home ration, and cash scholarship. And we had developed the roadmap for school feeding to follow, to commit to respond, to implement the roadmap. We had transit to some program to the national funded program, like scholarship. We use the government budget in 2014, and until now we fully use the government budget for scholarship, and all take-home ration we convert to the cash scholarship. And about the school meal, now we start handover from World Food this year. Last year, 2019, and we will commit to increase the scope over the next year. And as we know together, the COVID is a global issue. For Cambodia, we had a response for this, also respond for this, and the school in Cambodia had closed since 17 March 2010. Since we have 1% that have the COVID in Cambodia, we start to close all school in Cambodia, and until now we go on to close. And we also announced to restrict the large gathering and encourage social distance among community. And in the school closes, we inform all students to conduct the self-learning at home, and inform all parents to help their children for learning. And we promote the distance learning. We use video teaching, but teaching and learning video, teaching video, and we upload this video to the government website, Facebook page of government, and other application. And we also broadcast the video of teaching on TV. So the student can access to the government website and to the Facebook page to conduct learning from their home, e-learning, distance learning. In some area that cannot access the internet or cannot see the national TV broadcast on teaching activity, we create the small group of students. We create a small group of students among each village, and the teacher coordinate to teach them, but we keep the social distance. And for the subject of teaching and learning, we focus only on core subject. For example, for primary, we have 5 subjects. We have language, my language, Cambodian language, mathematics, social, science, and English language. But in the distance learning, we also we only focus on the core subject. There are two core subjects, mathematics and Khmer language, Cambodian language, and we learning also reduce the cluster of student worksheet. So the student that they learn from home, but the teacher can coordinate to they print out the worksheet, the student worksheet, and coordinate to distribute this worksheet to the all students by cooperating with the local authority. And in terms of school feeding, as we know together, the school closed, so we cannot cook for students. So about the school meal program, we convert that program to the food take-home ration, means that we provide the rice to the student. So we purchase or we get the rice and provide. We call the not call the student, but we call the parent from the poor family to get this rice. But we keep the social distance and issue not a crowd. We also develop the standard operational procedure for food handling, for cooking, for food distributing to students. We also working with school infrastructure, construction, including handling station, rent, water, catchment, school kitchen, and eating shelter. It's our activity that responding to urgently respond to the COVID. But we also have the challenges. As we know, many children and their parents are not, because in the previous, in Cambodia, we did not have the distance learning or e-learning, so very difficult. So many children, many parents are not familiar with the e-learning, and more people become vulnerable from impact of COVID-19 crisis. So social assistance support are required. Government of Cambodia has increased budget to support those, such as food take-home ration for food family, with the meal program, general food distribution, cash transfer, support for food poor family, cash transfer to support loss of employment in vulnerable sector. Finally, about the way forward or the plan for us, we also, I hope the school can open soon, but we will we still ensure the social system and both facility in school, and we still promote the e-learning, mean that we try to reduce the number of when the school open, we will reduce the number of students in a class or in a school. Mean that by we divide the student in two or three groups. Mean that to ensure the not crowded in school. So when we divide the student in two group or three group, mean that the student not go to school every day. So one group, example of one group can go to school Monday to the Wednesday, and another group go to school from Thursday to Saturday. mean that they can learn face-to-face with the teacher 50%, and we still promote the distance learning. So we can, when they don't go to school, they can learn from their house by using the e-learning. And for in terms of school feeding, maybe we flexible to the learning. Now we are on thinking about this, because our plan, the school can open, but the student can learn face-to-face in school 50%. So we can have two options. One option, they can eat about the school meal program. They can eat, the student can eat 50% at school, and get the food take-home result 50%. And another option, the second option, 100% is the take-home result, because we don't want all students, eat at school, because very dangerous for current situation. So and so is our thinking, and another way we waiting to see another country. We will learn from other country for this. And okay, I think I am all for today. If you have any question, please. Thank you.
Thank you very much, Mr. Chun. I know it's late in Cambodia. I had the privilege to visit your country last year during the Global Forum that was held in Siem Reap. And we visit the school feeding program. Congratulations, wonderful job, wonderful work that you are doing to take care of the students and to give them school meals in the schools. Thank you very much. Before we move on, we are achieving 90 minutes of webinar. I would like to make a specific remark that the United Nations Office for South-South Cooperation is a co-organizer for this webinar with us. Thank you to all the team of the United Nations Office of South-South Cooperation, and thank you for George Shediek for his support for this webinar. So what we will do, we are almost 90 minutes. We have a lot of questions. I will make some questions. I will bring some questions to each one of our panelists, and I would ask you to take 2 or 3 minutes to try to condense and answer these questions. Okay. I would start with I don't know, Mr. Shediek, are you there? I don't know if he's.
Yes, I am.
Okay, Jorge. So I have some questions here, and one of the questions are for you, Mr. Shediek. So you have 2 to 3 minutes to try to condense the questions, because we don't have so much time. Mr. Shediek, do you believe the countries are really benefiting from South-South cooperation? And what's the role of the North countries, the developed countries, in support South-South cooperation in your point of view? The floor is yours, George.
Yes. To the first one, the reason I'm here in this position is because I believe in South-South cooperation, and it's not a theoretical belief. I've seen it generating remarkable results. Daniel heard me several times in different speeches where I provide concrete examples where countries from the South sharing experiences really helped each other achieve remarkable objectives. Also, the expansion of the economies of the South has led also to great opportunities to access markets, to access technologies, to access productive capacities. So therefore, yes, South-South cooperation is really there and it's really achieving results. What is the role of the North? First, South-South cooperation is not a replacement of North-South cooperation. We should not accept that because countries of the South are becoming wealthier or they are developing their own social technologies, that the countries of the North are excused of their commitments of providing foreign assistance, foreign aid, foreign finance, and also opening up their markets. So South-South cooperation should not be conceived as a replacement of North-South cooperation, but as a complement to it. But at the same time, the countries of the North can assist through what is called triangular cooperation. Until BAPA plus 40 last year, triangular cooperation was was not a fully accepted concept in the global architecture. Now it is, which is the participation of third parties in facilitating the exchanges among countries of the South. Those can be institutions like the United Nations, like we were doing here, also private sector, other international organizations, and also countries from the North. And many of them have taken that because they found that South-South cooperation is a very cost-effective and efficient way of doing cooperation. In that context, I invite you to check an OECD publication prepared by the OECD Directorate of Cooperation, in which they highlight the importance and the value of South triangular cooperation. And then you will see also the very positive things they say about South-South cooperation. So please, if you are skeptical, the one who asked the question, join us. South-South and triangular cooperation are helping build a better world. I have to leave after this, so thank you very much for the invitation and for allowing us to sponsor the program. So from here, over and out, and thanks to the panelists.
Thank you, Jorge. Thank you for everything. You are fantastic. We have thousands of questions for you, but we will send to your office to answer to the people because we don't have enough time now, right now. Carmen, the questions for you, thousands of questions also. How WFP can support low development countries to get financial support to develop their national school feeding programs? This is one question. The second question is about the work jointly with UNICEF. Are you worried about nutrition in schools? How are you supporting countries to develop balanced nutrition menus? And if you have experiences to share about school feeding programs to early childhood and education centers.
The question,
can you answer?
Yes, well, I'll try with the 3-minute mark that you gave us. The question of how to support governments to stand up their own national school feeding programs is really at the heart of the work that we are now doing with South-South cooperation entities like the Center of Excellence in Brazil and others. It is really crucial, for example, that WFP plays a role in connecting countries so that they can talk to each other and figure out how did they manage to create the fiscal space for these programs. So one element of the answer of that question is countries themselves have a lot of answers that can be very useful for others. In many cases, for example, governments have been incredibly innovative in creating private trust funds, working with the private sector to finance the programs, using the proceeds of national lotteries, different kinds of private and public sector arrangements that allow for governments to finance the programs. Of course, there are other mechanisms, more well-known mechanisms. We work with donors all around the world to continue supporting national programs, and this can, of course, be transferred to the national administration. And one very important partner that is increasingly supporting national governments is the World Bank, but also other international financial institutions like the Inter-American Development Bank, the African Development Bank, the Islamic Development Bank. So we are increasingly working with these multilateral institutions to see how we can support governments afford these programs and implement nationally owned and nationally supported school feeding programs, which is our ultimate goal. Let me just say that in the partnership with UNICEF, our main goal is not just to provide children with food, although we've seen in this webinar, it's a really important element of it, but provide an integrated package of health and nutrition support to children. Food is a really important part of it, but so are other elements. And I'll give you an example. Water and sanitation. Today, in the COVID time that we are living in, the ability of children to wash their hands, to have clean latrines or bathrooms, and to have running water in schools is going to be critical, not just to safeguard their health in general, but also to mitigate the infections of COVID. So that's a really important element which UNICEF is uniquely prepared to support governments on. But there's other elements of a package, for example, malaria prevention. In many countries where we have malaria that's endemic, school sick, and we can't have that. We have supplementation. We need to provide iron tablets, for example, to adolescent girls to prevent them from coming to school with anemia. So that's another element that's really important. And also nutrition education. It is important for children to learn what is a healthy lifestyle, how to better eat, and all of these integrated elements into a package we hope can help the well-being of children as we move forward. And finally, the question on early childhood development. This is a growing, let's say, a growing element of school feeding programs worldwide. As governments start expanding the access to preschools, so early childhood development centers, preschools, kindergartens, whatever you call it, governments are increasingly expanding their access to these programs. And as they are expanding, of course, having access to food for these children is crucial. We're talking about 3, 4, 5 years of age. Their nutrition is critical. And here I would only say it is very important that the meals that we provide to all children, but specifically for the younger children, are fortified so that they can get access to the most nutritious meals possible. Thanks, Daniel.
Thank you, Carmen. Brilliant as always. Thank you very much. Mr. Pedro Mortara, about Mozambique. Mozambique approved the PRONAI, the school feeding program there. What Mozambique needs to universalize this important program in your point of view? And the other question is, Mozambique has enough schools for all students in the country? And what's the share of governmental funding in school feeding in Mozambique? Pedro. Thanks, Daniel. Could you please repeat the second question? Sorry. The second question is, does Mozambique has enough schools for all students in the country? Thank you. So let me try to quickly address these questions. The first one is a difficult one. What it would take to universalize school feeding? I think there's several aspects to it. So first of all, there is the need for an institutional framework, and here I'm talking about legislation exclusively for school feeding that moves school feeding into a state program as opposed to a government-run program. The second component is a very clear strategy, a medium and long-term strategy that includes a funding strategy. So it is assumed that Mozambique, as a lower income country with very limited capacities in terms of funding from the government, would initially have funding coming from donors, from mainly corporations of countries that generously donate to support school feeding, and would transition into a nationally funded school feeding program.
assuming that also the government would have higher capacity to support this kind of program. And in that sense, it would also require a much larger funding base. So from now, where school feeding reaches around 500,000 children, a bit less than that, to the 13 million children in primary schools here, more or less, it's still a fairly large gap. So it would need a lot of work to bridge these gaps, but I would focus on institutional framework as well as a strategy linked to funding. Now it leads to the third questions in terms of share of funding. Unfortunately, right now, the school feeding programs are all funded from external donors. So there's donors like Canada, like the US through McGovern-Dole, like private donors. Russia funds also through that swap. So these are the kind of donors that support school feeding now. And we are working with the government to try and put together a plan in which the government would slowly but increasingly take on these sort of responsibilities. And in terms of schools being enough or not, well, this is a challenging question, but we have in Mozambique sort of most children, if nearly all children are enrolled in schools in Mozambique. The issue here is on attendance and on classes being having too many children per class. So there is a lack of available classrooms, let's say, but not necessarily schools per se.
Okay, Pedro, thank you very much for our explanation. I will now send the question to Mr. Juan Carlos Martinez. I will make the question in English. Someone could translate. Colombia, as all other South American countries, suffer from inequalities. In your opinion, how can the school feeding program decrease the inequalities in the country? The other question is, what areas of Colombia are not covered by school feeding?
Gracias, Daniel. Efectivamente, hay mucha inequidad que estamos combatiendo cada vez más por reducirla y programas como este son fundamentales. Y te lo voy a poner como ejemplo concreto de mi experiencia pasada en lo territorial, en lo regional, haciendo ejecución directa. En los últimos 15 años, la gran mayoría de la población rural dispersa en el departamento de Boyacá solo estudiaba hasta el 5º grado, no podía llegar al 9º y al 11, porque eso implicaba transporte y alimentación, porque nadie puede madrugar a las 4 o 5 de la mañana y seguir sin ninguna comida hasta el fin de la tarde. Fue el haber garantizado la alimentación hasta el grado 11 absolutamente a todos y garantizar cupo y transporte a todos, que en menos de una década se pasó a más del 90% que está logrando acabar en el grado 11. Eso lo dice todo. No puede uno hablar de equidad si los programas no son completos, si los programas no tienen todos los componentes en simultáneo. Para la población vulnerable, este programa es fundamental. A veces nos pasa con los programas sociales que por el afán de mostrar grandes números se quedan en solo lo urbano, donde hay mayores eficiencias y mayores logros. Y no, aquí lo importante al revés es focalizar a la población más vulnerable. Y eso es indispensable para el éxito en estos procesos. Solo entendiendo la responsabilidad social de la equidad para fomentar una verdadera posibilidad de desarrollo en igualdad de condiciones es que esto se da y el programa es fundamental. El único departamento del país que a la fecha no ha hecho entrega de alimentación es el departamento de Sucre. Los principales ciudades de Sucre ya lo hicieron. Es el único. Ha tenido serios problemas en su lógica contractual, en su forma de solucionar los contratos que tenía previamente existentes. El último informe es que ya los acordaron y que ya arrancan. Parece que ese único caso lo tenemos. Sin embargo, ha sido muy complicado y este es un punto en el que estamos estudiando el tema y con el ayuda de ustedes lo estamos haciendo también, la necesidad de repensar la normatividad porque está siendo un cuello de botella muy fuerte en la lógica contractual, mecánica, que no se puede mover un tornillo de lo que se estableció inicialmente y eso hace muy inflexible el programa. Y ahí tenemos que buscar nuevos esquemas y en esto estamos justamente aprovechando la experiencia de ustedes. Si me permites una frase más, tú hablabas antes con Jorge de esa experiencia sur-sur. Mire, esto es a todos los niveles. Lógicamente tiene que ser así no internacional, tienen que estar las dos en paralelo. Igual que en cualquier país, también hay el apoyo de la nación, pero el apoyo entre los pares, el compartir experiencias entre los pares territoriales fundamentales. ¿O es que en la educación en el colegio basta con el docente y no se aprende del intercambio entre los estudiantes? Que hoy nos está haciendo falta y que tenemos que entender que tenemos que fomentarlo lo más posible porque el aprendizaje se da en ambos niveles. Muchas gracias.
Muchas gracias, señor Martínez, don Martínez. Ahora, now we will have the questions, last questions to Mr. Chun. Mr. Chun, about Cambodia, what's the main diet served in school feeding in Cambodia? And they are asking if you serve fresh food to the students. And also about the flooding, I would like to know how the issue of school feeding amid the monsoon flooding was dealt with. I didn't understand this question. If you understand about it, please, Mr. Chun.
Please repeat your question.
The first question. Okay, the first question is, what's the main diet, the menu served in the schools in Cambodia? And they are questioning if you serve fresh food to the students, like vegetables, like fruits.
Okay, for Cambodia, previously we cooperate with World Food. We implement the traditional school meals. So we provide rice, oil, fish can for students, but now to the home school feeding. So we provide the budget to school to purchase the food for the food and cook for students. So the menu in each school we have rice, vegetable, fish, and meal meat, but not all this not fresh, but we cook it. We cook it, and we and almost the food that we supply for the student, that cook for the student, is the food that fit to the current area, to the actual area, the actual area, that the flavor, like the culture of the area. So, but no the fresh vegetable for student, but we cook it.
Okay, thank you very much, Mr. Chun.
Yeah.
Dear colleagues, we have come to the end of our session. It has been a pleasure to spend the last almost 2 hours with all of you, talking about the two themes that are very close to my heart and to my life's work, school feeding and South-South cooperation. I would like to finalize, to close this session with the words of WFP's executive director. He used to say, until the day we have a medical vaccine, food is the best vaccine. As a result of COVID-19 and of the examples we have seen today, South-South cooperation can support WFP to live to our pledge, to protect the most vulnerable from hunger and malnutrition, and to prioritize assist to them. As the school around the world start to reopen, experience sharing spaces such as this webinar are critical for us to capitalize from the existing knowledge on school feeding programs across the whole spectrum of the program cycle. This event represents a concrete opportunity to demonstrate the added value of South-South cooperation to contribute and tap into existing expertise, capacities, technologies, resources, innovations, making countries stronger to adapt and resist during these testing times and beyond. From WFP's perspective, South-South cooperation can help us to achieve our dual mandate on saving lives and changing lives by sustaining existing progress on SDG 2 and advancing efforts towards zero hunger by 2030. If you would like to know more about WFP's work on school feeding and South-South cooperation, we invite you to visit WFP's Brazil Virtual Exchange webpage and the WFP SouthSouthMatch.com platform. Thank you again. Thank you to all the panelists. Thank you to all of you to stay with us during these last 2 hours. And I hope you all have a great day. Thank you very much.